Sherry is a busy mom. Her children range in age from 7 to 17. It was after her second child was born that she started to feel symptoms.
I was 32 and I just had my second son, and about 2 days after delivery I started to experience numbness in my feet, places of weakness up my legs, my knees, all the way up to my shoulders in various spots.
She had a lot of tests and symptoms that came and went. In fact, it was another 2 years until she was diagnosed. Even then, the future course was unclear.
When we got her diagnosis, initially we weren't quite sure what to expect. You don't really know the course of MS.
While each individual's course with MS is unpredictable, there are certain forms or patterns of the disorder that are identified to help determine treatment. The most common is relapsing remitting. It's what most people have when they are first diagnosed.
That means that they're going along, doing just fine, and then they develop symptoms, usually rather rapidly over a day or a couple of days. These symptoms build up. And then over time, again, typically in days to weeks, those symptoms subside. Often they'll go away completely.
And then people go along in remission for a period of time, which can be weeks, months, years, or decades, and then they have another attack.
Other forms of MS are called primary progressive, secondary progressive, and progressive relapsing. These terms describe the way the disease develops. The medication prescribed depends on the form of the disease. Another term you might hear is clinically isolated syndrome. It refers to the first attack of MS symptoms. Whatever form of MS you have, keep in mind that it does not have to define you. With a healthcare team you trust, you can develop a management plan that helps you go on with your life.
Certainly there are some people who will have neurological impairments that may interfere with some of the activities that they want to do. But I emphasize to patients that you should regard yourself as a normal person. And if limitations come about, we'll deal with them when they come about.
A number of medications are available today to help people with MS. Some work directly to slow the progression of the disease and reduce the number and severity of relapses or attacks. Other types of medicines may be helpful for dealing with some of the symptoms.
And which one is right for a given individual is a fairly detailed conversation between that person and the physician, because it has to take into consideration the nature of their illness, how long they've had it, the form it's taking, how much disability there is, and also their particular lifestyle issues as to what type of therapy would best suit their existence.
Ken's form of MS made him a candidate for what are called disease-modifying therapies. These have been only available as injections.
I was trained by the nurse practitioner on how to administer the injections, and I went back for retraining because I was so uncomfortable doing it the first time and had to get a refresher course. But one gets into the rhythm of it.
You would just start it.
Tanisha is also working with a nurse practitioner to handle injections in a way that lessens the discomfort. This is good training for caregivers as well. Getting the help you need can ensure you continue taking medicine as prescribed, your best defense against the progression of the disease.
And it's hard to take medicine where you can't actually see the benefit, because these medicines are designed to keep people from getting worse.
Great, and then you pull straight out. Very good.
One of the first things we ask individuals who are on therapy and don't appear to be doing well is, well, how often do you miss your medicine?
At one point, Christina was skipping injections because of how they made her feel. Side effects can be discouraging, but as Christina learned, good communication can make a big difference.
And somebody told me, you have to tell him. So I told him. So honesty is the key. And okay, fine. So we developed a different treatment plan.
People should never try to tough out side effects without discussing things with their doctor. We know, for example, that some of the medicines that we commonly prescribe for MS are going to produce certain side effects, but we have strategies to help reduce those symptoms. And it's always important for the person with MS who's experiencing some difficulty or some symptoms to talk to the doctor. Find out, is this something that's expected? Is it an ordinary occurrence? If so, what can I do to make it less bothersome?
New treatments for MS that can be taken orally are emerging. It's important that you speak to your neurologist about what treatment, now or in the future, is right for you. For women, there's another need for communication with the doctor about family planning. The doctor needs to know if you are pregnant, breastfeeding, or planning to become pregnant.
Push, 2. Whoa, nice.
Because MS can affect your ability to move around, physical therapy, or PT, may be of great benefit.
I definitely get stronger during physical therapy. Anything you do to help yourself gives yourself a psychological lift.
Stare straight ahead and then close your eyes.
Physical therapy can help with fatigue, balance problems, lack of coordination, pain, immobility, and weakness. Your healthcare professional can put you in touch with a physical therapist and help you find devices that add to your mobility. Sherry walks with leg braces, but she also has an entire collection of canes.
Some of them aren't fashionable, according to my teenage daughter, but they're fun.
She also uses wheels to get around the kitchen and keep up with her family.
And I got to tell you, with 4 kids, a scooter never looked so good in my life.
The disease-modifying treatments are only one aspect of taking care of people with MS. A lot of people with MS have symptoms that we can help with, sometimes with medications, sometimes with physical therapy.
There can also be mental health issues, which can be addressed with both counseling and medication.
It's important to monitor mood, and we can treat it.
I'm a big, strong supporter of getting help psychologically for this, because depression is one of the major factors for MS. And I haven't had any severe episodes with it, but I've had someone to talk to.
And got it? Yeah. Good.
There are also medications available for times when a patient develops problems despite taking injections.
Nice job. And
a lot of people with MS, even when they are taking the disease-modifying therapies, may occasionally experience a relapse or an attack. We will commonly prescribe intravenous high-dose corticosteroids for these patients. And I want to emphasize, these are not the kind of steroids that athletes have been abusing. These are steroids that reduce inflammation and help people recover more quickly from attacks.
MS is a lifelong disorder. Over time, many people with MS try some kind of alternative or complementary therapy in their efforts to cope with the disease. But it's important to talk with your neurologist instead of trying an unproven treatment on your own.
Some of these remedies can interfere with medications that people are taking or have unattended side effects that no one knows about because they haven't been tested properly.